Anti-corruption forum to get rid of collusion, price fixing and fake medical doctors in the health sector has been launched. It's also expected to help protect the new National Health Insurance Scheme from being looted. Political reporter Govan Whittles was at the launch held at the Union Buildings, back with us here in Johannesburg. Govan, good afternoon to you. So who then is part of this forum?
Well, Jeremy, it's a multi-stakeholder forum which includes not only elements of the criminal justice system but also NGOs. So we've seen the presidency team up with the health department as well as the SIU, the NPA, the Hawks, the FIC, a lot of acronyms, but essentially these are the people that will be investigating these allegations and complaints of fraud and collusion within the health sector. And then organizations such as Corruption Watch and Section 27 will be making sure that they hold not only the private sector but the public health sector to account and to make sure that they cooperate with this forum. Essentially, this forum is meant to safeguard the integrity of South Africa's health system, and it's being launched before the rollout of the National Health Insurance Scheme. And President Cyril Ramaphosa says that's to assure the public that the NHI won't be looted, but also to restore the confidence of South Africans in their public and private health sector. Of course, that on the back of the release of that health market inquiry yesterday by the Competition Commission.
Which was a very disturbing report in itself. So a wide swathe of experts on this forum, Govan, but what really is the President hoping to achieve?
Well, he hopes to clamp down on at least 22 billion rand worth of fraud which has been detected within the health sector, both private and public, every year. So at least 22 billion rand extra is being spent on securing medical services from private and public institutions, and this is through various means of a collusion and, as the President put it, sometimes doctors going to work and moonlight at private health institutions while they're still on call at public health institutions, which he says it's a practice which is widespread in the country. And then, of course, the falsification of documents when purchasing some of these medicines is what the SIU spends most of its time investigating. But the President said that he hopes it will turn around the health sector. In brief, let's have a look at what he said now.
The bill that is now before Parliament is intended to prevent undesirable, unethical, unlawful practices in relation to the NHI fund and its users. Therefore, if corruption in the healthcare system is not addressed decisively, it will undermine the government efforts to ensure universal access to quality healthcare. We must ensure that the pool of funds that is earmarked to ensure universal access to quality healthcare is not wiped out through fraud and corruption, and in this regard, this forum will play a critical role.
But, Govan, the President must be concerned, surely, about the state of corruption in the health sector.
He is indeed, and he's described it as widespread, but it's interesting because the corruption in the health sector takes place through a combination of actions by both the private and public healthcare providers. And the President says that he hopes that the launch of the forum would not only begin to recover some of the money that was fraudulently taken through corruption from the medical aid members as well as patients at hospitals, but it would also change the minds of South Africans, and particularly its healthcare professionals and doctors when it comes to providing healthcare. In short, that doctors wouldn't refer people to an ICU simply because they have a financial stake in those referrals. Let's have a look again at what the President had to say about the attitude towards healthcare in South Africa.
When you pay bribes to get treatment, when you offer money in return for securing or keeping a job in a clinic or a hospital, when you buy equipment or medicines you know are stolen, you are adding to the erosion of trust and to the decline of the healthcare services in our country. Worse yet, you will be depriving someone else to access that service and could mean life or death for them. Let's all remember that tomorrow it could be your child, it could be your parent, it could even be yourself in that ambulance or that hospital bed.